Hello viewers, welcome back to our channel. Today's video is for those students who were pursuing their medical program from China and Ukraine. Those students who have completed their pre-clinicals and their course was only and their clinical rotations were left, or their clinical part of the course was left for 2 to 3 years. But before we go into the details of the video, I would request all our new subscribers to like, share and subscribe our channel. Firstly, we would like to inform you that NMC has very clearly stated that they would not consider any clinical program which is done online or any such program wherein the student was not physically present. However, NMC through its public notice released on 29 July 2022 has given one-time exemption for those students who have graduated their medical program on or before 30th June 2022. Now we have to understand that for transfer which countries are available or the students have what kind of options to them. Russia, which we all know is one of the best options for studying MBBS due to its advanced infrastructure and the facilities provided to the students in their colleges. Further, Russia also has a demographic advantage with Ukraine, hence the students do not face any difficulty to stay in Russia. Their academic program is also very similar to Ukraine, therefore the students do not face any difficulty in studying in that same curriculum. However, we have to understand that due to this certain crisis which has emerged of late due to the war, there has been certain bans and sanctions which have been put to Russia. So in case the students who are studying over there want to appear for PLAB or USMLE in the near future, would they be able to appear in those exams? That remains a doubt. Furthermore, admission in the 6th year is not possible in Russia. A student who is taking admission has to study minimum 3 semesters, which means the student has to repeat the second semester of 5th year. The next country we are going to speak about is Georgia. Very few government colleges and more of the private colleges are allowing transfer in Georgia. However, any student who wants to take transfer can take in the private colleges in the Tbilisi region. But herein, we also like to tell you that Georgia also has its limitations. So what are the limitations? The limitations are that the seats are very limited in the private colleges. Also, the infrastructure is not up to the mark in Georgia. The next most important thing or the hindrance that the student face is the approval of visa, which takes around 3 to 4 months. Again, in Georgia also, admission in the 6th year is not possible. Next, we shall talk about Armenia. As we all know, Armenia has only one government college and rest all are private colleges. The fees there, however, is very affordable, and Armenia also has a good English speaking crowd. Accommodation is not a problem at all in Armenia. However, Armenia also has its infrastructural issues because the colleges over there do not have their own clinical setups, hence the students do not get required exposure for their clinicals. The Ministry of Education and Sports also monitors the admission process in Armenia. Due to this, last year around 1700 students who migrated from Ukraine and Russia, their admission was not approved by the ministry, and hence the students could not go to complete their program in Armenia. In Armenia again, the admission in their last year, which means 6th year, is not possible. Now we shall discuss about Kazakhstan. Kazakhstan is a country which is recommended for transfer because of its good infrastructural capacities and good clinical exposure. Embassy has nominated a few colleges wherein transfer is allowed. However, there are very limited seats and the fees is also on the higher side. In Kazakhstan, again, admission in the 6th year is not possible. Now we shall discuss about Kyrgyzstan. The government colleges in Kyrgyzstan cannot allow transfer because every year the Ministry of Education allots them limited seats for medical program. And due to the high demand in the government colleges, seats are always full. Therefore, there is no scope for transfer students. In case of private colleges, students taking transfer should be very cautious because on 1st April 2022, out of the 17 private colleges, only 7 could retain their license to run the medical program. The rest of the 10 could not retain their license and hence therefore they are not eligible to run the medical program. For further clarification on this case, one can visit the Indian Embassy, which is in Bishkek, their website, wherein the public advisory is mentioned. Now we shall discuss about Uzbekistan. Uzbekistan is a new country which has opened new opportunities for Indian medical students. Almost all the colleges in Uzbekistan are government colleges with proper clinical facilities. The program is very similar to that of Ukraine, and hence the students will not have any difficulty regarding the academic curriculum. It can be a very prospective country in near future for studying MBBS. However, as of now, there are no clinical batches in English medium. Very few of you know about such countries who have opened new opportunities for students due to the crisis situation. These countries were not as popular as the other countries which we have mentioned earlier as a destination to study MBBS due to their affordability of fees. Herein, I would take the opportunity to make you aware of the program that is run by them, and this program is specially structured for those students who have completed their pre-clinicals and are presently in their 3rd, 4th or 5th year. The program in these countries are structured in such a way that the student can complete their graduation within 1 or 2 years time. For example, if the student has completed their pre-clinicals, which means if they are in their 3rd year, then the student is eligible to undergo a program of 2 years of clinical rotation. If the student has completed 4th year, then the student is eligible to undergo 1 year clinical rotation program. And if the student has completed 5th year, then also the student has to undergo 1 year of clinical rotation program to complete their graduation and to be eligible for the licentiate exam of that country which is awarding the degree. The colleges in these countries are enlisted under WHO, ECFMG, FEMAR, GMC and also are state accredited, which makes the students eligible for licentiate exam not only in those countries but also in India according to the Screening Test Regulation Act 2002. The colleges in these countries also have a rich history of Indian FMG who have successfully completed their FMG examinations and obtained their permanent registration and also are practicing as registered medical practitioners across India, or they are pursuing their PG in and outside India. These colleges, by the virtue of getting recognized by ECFMG and GMC, also gives the opportunity for the students to be eligible to appear in USMLE and PLAB examinations respectively. The performance record of these colleges are mentioned in the website of NBE since 2012. The average passing percentage of these colleges have been quite significant. Herein we can say that if the national passing percentage has been 17%, then these colleges have a record passing percentage of 25% and above at an average. These colleges are conducting their clinical rotation program in their affiliated training hospitals in and outside the country. The designated overseas sites for these programs are primarily in USA, UK and Nepal. Nepal has lately become a very viable and authentic destination for the clinical flagship program for the students who are migrating from Ukraine, China and other CIS countries due to its advantage in the clinical exposure, because the program is conducted in the recognized medical colleges and training hospitals. Especially for the students who are in 5th year, this can be a possible option wherein they can complete their graduation in a span of 1 year. Even for those students who have completed their 3rd and 4th year, they can also finish their graduation program in 2 years or 1 year's time respectively, saving 1 year from their academic years. As I have mentioned earlier, these colleges have significantly subsidized their fees and have given relaxation in the application process. Also, they have made the credit transfer flexible so as to acknowledge the critical situation of the students and give them relief from the state of panic and confusion. We too appreciate this generous gesture of these countries and do believe that this clinical flagship program would be beneficial for the students.
हाय, मेरा नाम वत्सल पंचाल है। आई एम अ स्टूडेंट फ्रॉम यूक्रेन। मैं किस मेडिकल कॉलेज में अपना क्लर्कशिप कर रहा हूँ फ्रॉम मेड स्टडीज। थैंक यू मेड स्टडीज फॉर गिविंग मी दिस चांस टू डू माई क्लर्कशिप इन किस मेडिकल हॉस्पिटल। हियर द डॉक्टर्स आर वेरी मच हेल्पफुल। वो लोग बहुत सपोर्ट करते हैं और हमें नई नई चीज़ें सिखाते हैं रोज। एंड वी आर वेरी हेल्पफुल। वी आर फीलिंग वेरी ग्रेटफुल टू हैव द एनवायरमेंट्स लाइक दिस। थैंक you med studies, and the accommodation is also good over here.
For more such informative videos, I would request all our new subscribers to like, share and subscribe our channel. Thank you.